Welcome to the podcast, The Dental Breakdown. My name is Christian White. I'm the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. We are a practice management consulting firm for dentists and other healthcare-related businesses. Our sole purpose is to implement proven strategies through online and in-practice visits that result in the personal and professional success of you and your team. We are in the business of making the difference between good and great. This podcast will help your team have a larger impact on your patients, create long-term lasting relationships with patients and with each other, and increase the bottom line and be happier during the day. You can listen when you first wake up in the morning or just before you go to bed at night, in the car, on the way to and from work, or during your lunch break. This podcast was meant for you and your team's busy lifestyle. Each podcast will be between 10 and 15 minutes long and focus on the daily challenges, frustrations, and concerns you and your team face daily. All right, let's get to it. The scripted portion of the podcast is over. Let's introduce our guest to the podcast. This young woman is the first female president of the Minnesota Dental Association, which is an incredible feat. She is one of the more successful female dentists in the Midwest. She co-owns a company with her daughter Hillary. She has been a dentist for over 30 years and has changed thousands of lives. She is an advocate for the advancement of women in developing countries, and she is the president of the Delegation for Friendship Amongst Women. She is a mother and has been extremely successful. So let's welcome Dr. Kim Harms to the podcast, everyone. Yes, welcome. All right, Dr. Harms. Here's kind of an interesting question I've been kind of dying to ask you. Dr. Harms' blueprint for success as a clinical dentist, as a successful mother, and now as a successful co-owner of a business. Take it away.
Well, I think the first thing to remember is that dentistry is not your life. It's your profession. And it doesn't prepare you well for life. You don't usually walk around with people kind of waiting on you and introducing you and cleaning up your messes. So it doesn't prepare you for life. And so you need to really focus on the rest of your life as well. Make sure your family situation is stable. Make sure your relationships with people are stable. Don't leave your kids out. Make sure you include them. And just have a stable life. All those things that are good to live a good life are important for the blueprint for success. So have a good, trustworthy background. Mm-hmm. When it comes to being a mom, I think that I have two daughters. I did lose my son, Eric. I have two daughters, and I taught them to go as far as they could go in whatever they wanted to do. And if they wanted to stay home for a while and have kids, to go ahead and do that. But I have to say, both daughters are attorneys. I wanted them to become dentists, but they didn't follow that path. They both became attorneys, and when they both quit their jobs to have babies, I was not really excited about that. I thought, oh my goodness, what are you doing? But they were right. They did the right thing because my first oldest daughter, Hillary, has started her own company from scratch. She's my boss. She works specifically in dental law. So I just couldn't believe she got back into dentistry in a different way. And so now she's my boss. And after I had to quit dentistry because I had a nerve damage in my drilling fingers. So I was working one day and done the next forever. And after a few years, she wanted me to help her with her practice. And I did. And it's been absolutely wonderful because I can use all the information that I got from practicing and help her with dentists that are coming out. And especially when we're, in fact, she planning on doing a podcast called The Dental Empire pretty soon, having them all kind of come together and work together, especially with women, learning how, some of the special things women have to deal with that men might not have to deal with.
True.
They're a little different.
Very true. That'll be a really good thing when she produces that. Mm-hmm. She told me about that. I'm excited to hear about how it's going to go. So here's this piece. So if I take everything you just said and said to the young female dentist who's listening right now, who's either in dental school, just started into dentistry, maybe she owns her own practice, maybe she's an associate, or maybe she's working at a corporate office. Your top three suggestions or for success, your top three pieces.
Okay. For the first one is keep focused on your whole life, including your family, your friends, your relationships. Keep those in top order. Learn how to forgive, because sometimes that's part of keeping all that in top order. Keep those in top order. Dentistry is just your profession, but do the very best you can. Give everything you can to your patients. Make sure they can trust you. Be worthy of their trust. Treat your employees, your team as a family. And I think that probably the last thing is just to remember that when it comes time for retirement, all of the accomplishments you had in dentistry are really not even considered. You have to make yourself happy with life without your dental profession. You need to focus on that from the beginning, because so many of my colleagues retire and then fall apart because they don't know what to do.
That's very true. They wake up one day and they're not an operatory one, and they don't have tooth dust all over the floor.
Right.
So they're like, now what do I do?
Right. And they have to clean the toilet.
Yes, they do.
So there you go.
The floor.
And mop the floor.
And mop
yes,
the
they
floor.
do. That's right.
And they got to go to the store and get groceries.
That's right.
And they got to do some other things they haven't had to do for. Yes, I understand that piece. So let me ask you this piece. So from a business standpoint, if we're kind of maybe shift a little bit, talk a little bit about dollars and cents.
Yes.
You've also had a really large, some really good experience with that.
Yes.
Some things to do, some things not to do. Maybe parlay that. Talk about that.
Well, for me, I am more of a people person, and so is my husband. And so our first advice was, we hired your dad. I mean, we hired you and I are both in a business where father and son, mother, daughter work together.
Correct.
But we hired your dad. And so he helped us with the business part of the practice, and that meant scheduling. I think, you can schedule efficiently and effectively. That is like the number one tool, because, we were one of the other best things that we did was we saw emergencies that day, that time. Patient walked in with an emergency. We found a way to work them into the schedule with the staff that we had. I love doing root canals. That was probably a practice builder. But we also worked in a small town, and I was on the school board there. My children went to school there. People knew us. We developed relationships with the community. That was very helpful. We did some charity work for the community when some of the students needed help. We would just come and do the work for free. So I think establishing those relationships with your patients and keeping your patients for the long term. We focused, when I look back at what was important, building up that hygiene program is really important, because those are the patients through thick and thin, through recession or good economic times. Those are the people that are kind of coming in every so often, whatever recall system they're on, and focus on those. Don't neglect those regular patients that just come and get their teeth cleaned. Sometimes we neglect those. Don't neglect those patients. That's the basis for your practice.
There was a little piece I gleaned from what you said, and this is something I think that has been lost a little bit as the newer generation is coming in. If you want to have a successful practice, it's going to require more than just being between operatory and 1 and 2 for 8 hours a day.
Absolutely.
You also need to come out of the operatory and do some meet and greet and do some involvement in the community. Tell us a little bit about that.
Right. Well, I was a member of the school board, which was very helpful. So I got to know people in the community. My husband worked on the Economic Development Council, so we got actively involved. And I think that we showed up at every game, every activity our kids were involved in. My husband coached for like 24 seasons. We just got involved in the community, and that brought us great joy. And my career was ended suddenly in one day at Mayo, and when that career was ended after a little bit of a meltdown, of course, I had other things. I had friends. I could look outside the world and see that I could do other things, that I wasn't defined. Now, my retirement portfolio was not exactly what it should have been at 54. So but then I just downsized a few things. But it was still really good, because we had a great practice. We had built up a great practice. We can both retire if we want. We don't even have to work if we don't want to, but we're choosing to work. And that's because we also manage our money. Don't go and buy the castle house. Build the barn. Build your practice first. Let that grow, and that's what's going to build your castle. Really a problem I think some people have today.
That is it's a big problem. Actually, it's a big problem. The castle's coming before you even find a horse.
Yes. Don't do it.
It's something that it's a lot of younger dentists. I understand, where they're coming from. I've been living off of, macaroni and cheese or less than that in dental school. And now it's like I have this sudden influx of money, and it's like, woohoo, yeah, here we go. And that's a tough thing to get across to those younger men and women who are.
You can add meat and vegetables to your diet and just, buy a nice house, but don't buy the castle.
Yes.
Wait till because then what happens, what I've seen, and it's horrible, is then you are driven by the money in the practice instead of building up a wonderful practice and the money then just flows in. You artificially, try to pull the money in, and that seems to be your focus. And then patients will pick that up in a second. The minute you walk in the door, they'll pick that up.
They will.
So don't do it.
Very good points. All right, that's a very good point. So let me shift gears here a little bit. So you are one of the few dentists that I know of who's kind of parlayed into the speaking industry. And you've become a tremendous speaker, and you've done it for a long time, and you're one of the better ones out there. So tell me about that piece for you.
Well, it's when I was president of the Dental Association, obviously I had to do a lot of speaking. I used to be a terrified speaker. I mean, I would
really,
yes,
no way.
I would, and I would just have a little panic attack before I got up on stage until my very last speech at the Minnesota Dental Association. For some reason, it was like, okay, now I'm done. No one's going to judge me. What the heck? So I think starting out, many people are afraid. I worked for 21 years as a national spokesperson for the American Dental Association. And during that time, I did speak for the organization, but I couldn't parlay out to anything else. I couldn't speak for anyone else. I couldn't work with my daughter. I couldn't do anything else. And so I retired from that after 21 years. And now I am going out and speaking. And I have 3 national meetings this year, which was really nice. I think the heart of my speaking is I have a story to tell. I've been through a lot of adversity. I've been a long time in dentistry. I have a lot of stories to tell. And my daughter, Hillary, I have to give her credit. She saw that. The reason I'm doing this is she saw that and said, Mom, why don't you come and work for me? And I'm like, well, maybe I could do that. So she's the one that really encouraged me. So the daughter's encouraging the mother,
right?
Because she works with a lot of young women in her law firm, and men too.
Yes.
But she encouraged me. And I just speak from the heart. I get up there, I speak from the heart, I tell the story like it is. I'm a grandma, and grandmas don't have to, cover things up. I don't sugarcoat anything. I just tell it like it is.
No, you don't.
Because I've reached that point in my life where I can do it. I can wear purple, I can do these things. But, and I think that's really, I speak from the heart, and I've had a lot of experience. So I speak from experience and from the heart. I'm really passionate about conflict management. I'm really passionate about emotional emergencies in the dental office. And when you're passionate about something, it's easy to speak about it.
It is. There's an interesting quote out there, and I don't remember who said it, but every person on the planet owns one thing that nobody else owns, and that's your story. You have a story, I have a story, and nobody else owns that. And and for being a speaker, people want to hear that. And that's you've done a wonderful job of bringing that into your speaking, and it's been very successful for you. Okay, so tell me this little piece, okay? Are you ready?
Yes.
You have a nickname.
Yes.
Okay. Well, good, you're laughing. Okay. The Dental Mediator.
Yes.
Tell me about that.
That was my daughter. I have to give my daughter credit for that name because as she was talking me into coming into business with her, she's thought we need dental mediators because dental offices many times have conflicts, and there's nobody out there, very few people out there that really can identify with the conflict. To be neutral, a mediator is neutral. True. So I went back to school and now I qualified civil mediator in the state of Minnesota. And a mediator is a neutral. And I'm a middle child, so I'm really good at being neutral.
Oh, perfect.
And so I think so what I do is I go out and try to help people solve conflict, help people work through conflicts. What I'm trying to do is have dental offices develop their own conflict managers within the office, which we did. We had 2 conflict managers in our dental office. And that way, nobody has an excuse to allow a conflict to continue. They can't say, I don't want to go to the dentist, I'm afraid. I don't want to go to the office manager, I'm afraid. Neutral conflict managers within the office will allow people, when they have a conflict and they're upset about something, they have someone to go to. And if they don't go to it and complain about everything back in the sterilization room, the rest of the staff says, don't give this to me, give it to the conflict manager. And you can stop conflict right in its tracks.
So, here's an interesting piece. So in dentistry, dentists, both men and women tend to focus on hard issues, production, collections. and sometimes they're not very nice about parlaying that to the staff.
Right.
Because I have been in those meetings.
Absolutely.
I should have had you in some of those meetings.
I'd be happy to help you with that.
So how can the conflict management piece and bring that to a dental office, help some of those issues?
Well, I was a member of the St. Paul District's Speakers Bureau, which was one of the best organizations I was ever in. And it was a bunch of dentists, and we always talked about things that were going on there. And the number one concern they had was conflict in their dental office. That was the number one headache. So I think the important thing when you're going to an office and you're having that meeting, you're talking about the goals, because you need to set goals. Right. And I think, you need to set goals with the patient. You need to set goals with your scheduling. It's important, I think, for the dentist to first of all listen, which sometimes we don't do as much, not bury their heads when they see conflict happening, and to let their staff, the team know that building this dental office, as we're doing, requires that everyone do their part. And our number one focus is serving the patient. So if you're doing anything, and conflict is something that really does impact the care of the patient. If you're doing something that negatively impacts the care of the patient by having conflict, you have to stop that, because it's going to affect us, it's going to affect your paycheck, it's going to affect your ability to come into work and be happy. And so I think motivating the staff to resolve the conflicts themselves will relieve so many headaches from the dentist.
Correct. Most dentists, and it's not just the male dentists. I have, a lot of the female dentists we've worked with, they do the same thing, and they almost deal with it sometimes worse than the guys do. And then sometimes our meetings we have can get very interesting.
Well, and we look at generations, and some generations are, my generation, the baby boomers, tended to talk to people more. We talk on the phone. We talk. The new generation, the millennials and X and Zs, they tend to talk electronically. And so you can't solve problems electronically very often.
No, you can't. Well, it looks like our time is winding down. That was wonderful. That was really good, impactful information, Dr. Harms. Thank you for sharing that.
Thank you.
I think some of our listeners are going to, either call you or they should call you. I mean, believe me. Thank you.
TheDentalMediator.com.
Dental Mediator. Thank you very much for being here today. To all of our listeners, if you find value in our discussion, please go to whitedentalconsulting.com/breakdown, or you can call us at 952-432-3322. And thank you for listening today.